present the other side of the same installation story, we have one of our really esteemed partners, Dr. Adeel Tahir, who's the Director of TB Program at Mercy Corps Pakistan. He's going to be discussing the use of AI, specifically CAD4TB, for the TB detection experience from Pakistan. Hello,
Thank
Dr.
you,
Tahir.
Katya. Thank you very much. And I hope I'm loud and clear. Next slide, please. Yes. So I'm going to present our experience of using CAD4TB for the detection of TB in Pakistan. Next slide. Next slide, please. Yes. I just like to briefly, previous slide, please. I'd like to briefly update the audience about Mercy Corps. Mercy Corps is an international organization that is working in 40 countries in the world. And in Pakistan, Mercy Corps is working since 1986. In TB program, Mercy Corps is principal recipient of global funds since 2007. So continuously over the last more than a decade, we are working in TB control initiatives in Pakistan. And mostly these initiatives are for private healthcare sector. If I talk about the TB prevalence in Pakistan, unfortunately, Pakistan ranks 5th among the high burden countries with regards to tuberculosis. As per the last global TB report by WHO, should I continue? Yes. As per the last global TB report by WHO, there were 600,000 cases that were produced in Pakistan each year, and Mercy Corps and National TB Control Program were able to identify 470,000 of these cases. So still there are certain cases who are missed from notification, and mostly these are the patients who are unaware of available TB services or who are in areas which have limited access to healthcare services. So what we are trying to do is to enhance the reach of these underserved patients to our health facilities, either through the availability of the healthcare services or we are directly reaching to them. And that the main impact of doing that is to reduce the transmission of tuberculosis and decrease the morbidity and mortality associated with disease. Next slide, please. Yes. As I mentioned, what we are trying to do is we are providing both active and passive care services for the patients suffering from tuberculosis. In Pakistan, we have taken on board more than 13,000 healthcare facilities from private sector. These are the privately run GP clinics that are working with us in 119 districts. But still, there are certain areas where the patients do not have access to these services. So we have designed an intervention of active case finding for these patients. We have arranged 40 mobile vans that are equipped with digital X-ray machines with CAD4TB software and gene expert machines. And we organize chest camps in the areas which are far flung from the main health facilities. So you can see that from this slide that we are covering 89 districts through this intervention, and all the provinces of Pakistan are covered. And we are working with 6 partners for TB care services. Next slide. Yes, please, next. Yeah. So how CAD4TB is helping us in this active case finding of TB patients? The best thing that CAD4TB has done, that accuracy of diagnosis has been increased. When we use the score generated by CAD4TB, our physicians who are in the chest camps, they are quite comfortable and confident that ordering the sputum sample for these patients for gene expert would yield results, and the accuracy of software is quite high. I will explain the data in the next slides. Then the diagnosis is quite rapid when we use these X-rays as a screening tool. And also it is very cost effective because in Pakistan, we cannot take trained radiologists to far-flung areas with us so they can read the X-rays. So through this technology, the X-rays images are read and a score is generated. And based on the score, we identify whether the person is suffering from tuberculosis or not, and we label them as TB presumptive accordingly. Next slide. Yeah. So we are implementing these services through 40 mobile vans. And as I mentioned, these are equipped with digital X-ray machines with CAD4TB software. And also all these mobile vans will now have gene expert machines. So on the spot screening and diagnosis of TB patient is possible even in far-flung areas of the country. And it has allowed us to identify TB patients more and more. Just give you an example that in last month, we have conducted almost 600 chest camps through these 40 mobile vans, and our average case yield is 2.5 patients per chest camps. So we have identified around 1,500 TB patients through this intervention. The vans go into far-flung areas. We have 3 staff members on board with us. One is van driver, one is gene expert technologist, and one is medical imaging technician to use these digital X-ray machines. When we go into the far-flung areas, our district team already present in the district, they have arranged chest camps, and there are around 100 people that are present usually at the site of the chest camp. So we screen them using these X-rays and CAD4TB, and those who have score more than 60 or who have symptoms of tuberculosis, we order sputum testing for them through Gene Expert, and then on the spot diagnosis is made possible. Next slide. Yes. As Sohail Saab has mentioned, now we are in the process of upgrading our active case finding services through the 25 portable X-ray machines that we have already procured. We are in the process of hiring X-ray technicians for these 25 portable X-ray machines. And then once these technicians will be hired, we are planning to train them through the support of Sohail Saab and Delft in the month of June. So once these technicians will be trained, we will deploy these 25 portable X-ray machines in 25 districts of the country, which are definitely high burden districts. So the idea would be that these machines will be placed in selected hospitals or health facilities, and we screen the patients through X-rays. But we also take these machines in the far-flung areas or in areas which are not accessible by our mobile vans because of the narrow roads and other issues. So we take these machines into the far-flung areas and screen the patients, particularly the contacts of TB patients, and through these X-rays. If the X-rays of these contacts are found clear, we offer them TB preventive services. So through this X-rays and CAD4TB, we are not only diagnosing TB patient, but we are also trying to offer preventive services through this intervention. Next slide. Next slide, please. Yes. Now I'd like to highlight the data. We have recently completed our last grant that started from July 21 till December 2023. In this grant, we have conducted a previous slide, please. Yes, we have conducted 5,910 chest camps, and we did X-rays of 155,000 people. Out of those 155,000 people, we found that the people who have scored more than 60 were 24,000. But there were 131,000 persons who have scored less than 60. When we order gene expert testing for the persons who have scored more than 60, we found 2,000 cases. And so the percentage of detecting tuberculosis in persons with high CAD4TB is 8.3%, which is quite high as compared to the persons who have scored less than 60. and the yield in those who have scored less than 60 is 1.7. And just for the information of the audience, as I mentioned, that we take a doctor with us for these chest camps, and sometimes based on the symptoms, even if the score of CAD4TB is the patients. But definitely, if the score is higher, you can see that the yield of tuberculosis is quite high, and a very cost-effective intervention. Yes, next slide. For the data of this year. Yeah. So
Hello, Dr. Tahir. Are you there? I'm sorry to everyone who's
yes,
listening in.
I'm back. Sorry.
Yeah, oh, perfect. Thank you.
I'm back. I think sorry, it was a disconnection. Okay, so
Yeah,
I was
it's
talking
absolutely
about the
fine. You
data
can
for this
continue.
year.
Yeah, thank you.
Thank you very much. We have conducted 645 camps from January till March this year, and we have conducted X-rays of 32,000 persons. Again, we have found that 3,472 persons have scored more than 60, while 28,000 have scored less than 60. When we did gene expert testing of the person with score more than 60, we found 408 TB patients, and the yield is 12%. But in those patients where the score is less, we have just found 184 MTB detected cases, and the yield is 0.7%. So clearly, it shows that CAD4TB is helping us in identifying more and more TB patient, and also it is very cost effective because we only order gene expert testing for those patients who have high scores. And from this intervention, we have also so far found 13 drug resistance TB cases as well. So next slide, please. I would like to discuss some of the challenges. Okay. The challenges through this intervention are very few, but I like to highlight for the purpose of this webinar. Yes, the CAD4TB boxes are helpful for us, and they work in offline mode with the areas where we have limited internet connectivity. But if we have to do some troubleshooting, then we need reliable internet connectivity. So we are having some issues, particularly in those areas where we have limited internet connectivity. We are facing some logistic challenges through this intervention. Yeah, these are not directly related to CAD4TB, but for the mobility of our mobile vans, taking staff with us to different districts, this is a big challenge, but we have learned so far, and we are trying to continue this intervention in the next 3 years at least. Then the acceptance within healthcare workforce, initially the doctors were reluctant and they were not relying on this CAD4TB technology. Instead, they rely on reading the X-ray imaging themselves. But with the passage of time, our experience for the last, I think, around 5-6 years using CAD4TB, now the doctors are very much reliant on this technology, and they prefer to use the score for diagnosis of tuberculosis patient and for ordering gene expert testing. So this is a brief overview of the work that we are doing, and we are thankful to Delft Imaging for helping us in this important intervention. Thank you very much. If you have any questions, I would like to, I'm happy to answer. Thank you very much.
Thank you, Dr. Tahir. I would like to pass the mic to